Hi, my name is Matthew Pope, and this is my informative speech entitled Awareness is Key to Preventing HIV. With over 1.2 million people living with a human immunodeficiency virus, almost a fifth are unaware of their status. This is why HIV awareness and prevention is so important for everyone. You may have a stigma when you hear AIDS or HIV. Today I plan on breaking those stigmas by giving knowledge and history of the virus, explaining how it is transmitted, and the effects on the body. Hopefully the following information will break those stigmas and educate some peers on the importance of understanding this virus and how it influences everyone in their day-to-day lives. As a counselor at the Kansas City Care Clinic for people living with HIV and AIDS, and an active participant on the advisory board, I have seen and helped all kinds of people in different stages of the virus. To begin, knowledge on how HIV originated and developed is key in understanding the overall impact the virus has on us all. There are many theories as to how the human immunodeficiency virus came about, but there is one cause widely accepted by scientists and the Center for Disease Control. Although the virus is only transmitted from human to human, it is generally accepted that the virus stems from a similar virus found in chimpanzees in West Africa. It was thought to be contracted when hunters came into contact with infected blood. After the virus was transmitted, it mutated with the human body, creating the new virus, HIV. Over decades, the virus spread over the continent and to many other countries. The virus started existing in the United States starting in the 1970s, and according to the Center for Disease Control, doctors began to report extremely rare types of cancer, pneumonia, and other extreme illnesses in Los Angeles and New York regions, which were the main places for immigration in the United States. Granted that the virus was around for quite a while, public health officials did not coin a term for this until the early 1980s, calling it the acquired immunodeficiency syndrome because of the lowered immune systems. After the term AIDS was coined, observation began and scientists discovered that AIDS was caused by the human immunodeficiency virus. AIDS is considered the final stage of HIV infection, where the immune system is greatly damaged, has trouble fighting off diseases, and ultimately leads to opportunistic infections. HIV leads to AIDS by damaging the body and killing off the CD4 T cells, or the helper cells, that help to fight diseases in the body. Once the virus enters, the body produces antibodies to try and fight it off. Persons that become infected with the virus can take up to 2 weeks to produce these antibodies. This is the first time that someone can start to produce symptoms. There is also a window period of 3 months that it takes for antibodies to become detectable within the body. It is important to remember that only HIV tests and doctors can diagnose the virus because signs and symptoms vary from person to person. The Center for Disease Control states that the main symptoms associated with the virus are flu-like symptoms, fever, headaches, tiredness, weight loss, enlarged lymph glands, and various skin diseases. If the virus is not treated, AIDS can manifest within a few years or even less. For the time being, AIDS can only be diagnosed by a doctor when your CD4s have fallen below 200 cells per cubic milliliter. According to AIDS.gov, a normal range for someone not infected with the virus is 500 to 1,000 cells. Along with that, the federal guidelines for HIV treatment request anyone with CD4 counts at or below 350 cells should begin their treatment. Once a doctor has diagnosed a patient in AIDS range, they will always be considered as having AIDS even if their numbers rise above. This is why the goal is to become undetectable or having a viral load under 20 copies. The viral load can be described as a measurement of the amount of HIV virus in the blood sample expressed as copies per milliliter per Mosby's Medical Dictionary. HIV uses the CD4 cells to create more copies of the virus and can use it many times to create hundreds of copies before ultimately killing it off. The process in which the virus uses the CD4 cell is commonly known as AFRICAM. This acronym is what we use as counselors at the Casey Care Clinic to describe what happens in the cell at the multiple stages. The HIV cycle starts with attachment. When the virus binds to the receptors on the CD4 cell, the virus sends messages into the CD4 to let the virus in. Once it is bound, the virus is allowed to dump its contents into the CD4 T cell, and this is called fusion. The next stage is reverse transcription. So once inside, the HIV RNA turns into a double-stranded DNA. The enzyme reverse transcriptase that was dumped in previously aids in this process. Next comes integration, where the DNA hides itself in the human DNA, in the CD4 T cell nucleus. The T in the acronym stands for transcription. This is where copies of the HIV DNA are made and released from the nucleus into small packages. Each of these packages contain information on creating new HIV virus. Following that comes assembly, where the DNA packages combine to create an active virus. Once active, budding occurs, and the new HIV pushes itself out of the CD4 cell. When doing this, the virus steals a part of the cell's protective coating. By breaking the coating, the virus ultimately kills off the cell. This is why medication is so important. It drastically improves the body's health and slows the overall progression of HIV. There is no cure for HIV as of yet, mostly because the virus can hide itself within protective parts of the body, such as the lymph nodes, reproductive organs, and the brain. A person must be careful when starting a new regimen of medication, because any missed dose can result in a mutation of the virus and can cause HIV to become immune to the specific drug. This is why doctors encourage the every dose, every day, every time policy. The medical practitioner should work with their patients to come up with a set schedule from the beginning to allow proper follow-through. Before you get to the point of treating HIV, the most important thing to remember is the prevention of contracting and spreading the virus. The main confusion is associated with how HIV is even spread. The predominant way people become infected is through vaginal, anal, or even oral sex with someone that has the HIV virus and does not use protection. Another common way is by sharing needles with someone that has the HIV virus. It is important to remember that you can contract HIVs in many other ways as well. Anytime you come in contact with bodily fluids such as semen, blood, vaginal fluid, breast milk, or any fluid containing blood, you have a chance of getting this virus. There are many ways to prevent getting the disease other than simply choosing to abstain from sexual encounters. If people do choose to have sex, the use of a latex condom or a barrier the right way every time is the best way to greatly reduce the risk of getting the virus. It is also extremely important to remember that any type of drug taken can impair one's judgment on being safe and ultimately staying clean. One reason why people do not take these precautions is because of the formation of stigma around HIV. The Casey Care Clinic states that the creation of stigma is the result of existing stereotypes, biases, and other forms of oppression in our society directed at individuals or groups. The effect of stigma can cause a person to be less inclined to seek HIV testing in environments where they perceive others to be judgmental about their sexual or drug use behavior. In turn, individuals who exhibit concerns of stigma are more likely to postpone seeking care or not even follow up with care. And possibly the most important is the effect of disclosure of someone's status. The decision to reveal HIV status is based on the person's comfort level. The more accepting and non-judgmental a social network is, the more likely an individual is to disclose and prevent spreading the virus. All in all, gaining knowledge on the virus and its history, how it's transmitted, and the effects on the body are important for the prevention of spreading HIV. If more people knew all the facts about this epidemic, the stigma could be broken, and people ultimately could deter the escalation of numbers of people living with HIV and AIDS. Stay informed. Inform the ones who are not. Stay safe and get tested often, no matter who you are. Thank you.